Hello everyone, I am Dr. Tanvi Mahant, consulting homeopathic physician, and welcome back to my channel HomeoHeals. In today's video, we are going to talk about Hashimoto's thyroiditis, which is a very common autoimmune disorder which I see in my practice. We are going to talk about what is it, what are the symptoms, and how you can manage it with homeopathy. So let's begin the video. Hashimoto's thyroiditis, or what is also called as lymphocytic or autoimmune thyroiditis, it is an autoimmune disorder. So in which the antibodies damage your own thyroid gland. So we have all heard the term about antibodies, which are usually to fight the infections or foreign bodies, like external foreign bodies like bacteria, viruses, right? But in autoimmune diseases, what happens is our antibodies attack our own glands, and that is why it is known as autoimmune disorders. So in Hashimoto's thyroiditis, as we said, that the antibodies damage your thyroid gland, and which causes inflammation of your thyroid gland, and over a period it can also cause swelling of your thyroid gland, which we called as goiter. Over the years, what happens because of the inflammation and destruction of your thyroid gland, the thyroid gland becomes underactive, or there is decrease in thyroid hormone production, and so the patient develops symptoms of hypothyroidism. So this is in short what is Hashimoto's thyroiditis. Usually it is a genetic condition, so it runs in family. It is also seen most commonly in women than men, usually middle-aged women, but also can be seen in younger women. Hashimoto's thyroiditis takes a lot of time to show symptoms, so it is a long process. It takes many years. In some patients, when you do antibodies, thyroid antibodies, which is usually anti-TPO antibodies, will be high, but the thyroid hormone levels will be normal. The patient could be asymptomatic, and as I said, it takes a lot of many years for the patient to develop symptoms of hypothyroidism. So talking about what is the presentation in this disease, like what are the symptoms which Hashimoto's thyroiditis present with. So Hashimoto's thyroiditis is the most common cause of hypothyroidism. So it presents with symptoms of hypothyroidism and also sometimes with swelling of your thyroid gland. So thyroid gland, which is situated in your neck, you could see females who could present with swelling of the neck, which could be a thyroid swelling, and it could be because of autoimmune thyroiditis. Now talking about the symptoms of hypothyroidism, which are most commonly, patient might feel fatigue, lazy, sleepiness, patient might gain weight, and also there is a lot of difficulty in losing weight with patients with Hashimoto's thyroiditis or hypothyroidism because of slow metabolism. There could be non-specific muscle pains, aches, there could be muscle cramps. In females, it could lead to menstrual disturbances. Also, it could contribute to infertility. There could be abdominal symptoms like bloating, constipation, so hair fall. These are the common presentations of Hashimoto's thyroiditis. So this was about what is Hashimoto's thyroiditis, what are the symptoms. Now, how do you know that you have autoimmune thyroiditis? Obviously, the patient will come with symptoms of hypothyroidism. In blood tests, you will look for thyroid function test, that is your TSH, free T3 and free T4, in which the TSH will be high and the thyroid hormone levels will be low. You also need to check for thyroid antibodies in this case, which is usually anti-TPO antibody test, which is most commonly done. And if the levels of the antibodies are high, it suggests that you have Hashimoto's thyroiditis, which is contributing to your hypothyroidism. Sonography of your thyroid gland is usually not needed. In some cases, the doctor might advise if he or she feels that it is required. Now, most importantly is management of Hashimoto's thyroiditis. So, as a homeopathic consultant, I see many females struggling with hypothyroidism, in which I've seen that the thyroid dose, which they take, thyroxine dose, just keeps on increasing. The female has difficulty in losing weight. Symptomatically, they are not doing better, and when we do the antibody titers, they're usually high. Now, as I said, it is genetic disease, and environmental factors also contribute to it. In homeopathy, what we do is we give each individual different medicine depending on their symptoms, what is the cause, what is the ailments from. Sometimes Hashimoto's thyroiditis could be triggered by certain stressful event in the life. It could be triggered after certain viral diseases. So we try to address what is the cause, what is the individuality in each patient, and accordingly we give a tailor-made homeopathic medicines. With medicines, what happens is the female or even sometimes male, the patient starts feeling better symptomatically, the thyroid levels get back to normal, and even the autoimmune titers, in many cases it reduces as compared to the previous report. But talking about what exactly happens, it is an autoimmune disease. So many times the patient is going to have antibodies, but with homeopathy the thyroid function tests are normal, symptomatically the patient is better, and we can even stop homeopathy after maybe years of treatment if we feel that the patient is doing much better, and just keep on checking the thyroid function test maybe twice a year, right? So I have patients with autoimmune thyroiditis who have stopped homeopathic medicines, and they are just annually or twice a year they check their thyroid function test, and if it is normal, you don't need to take any medicines. Yes, but it is a long process. It is not that you take homeopathic medicines for 1 or 2 months and it's going to be normal. No, as I said, it is a autoimmune disorder. You will require years of treatment with homeopathy before we stop the medications. So I hope this video was helpful to you, was able to solve your some doubts about what is Hashimoto's thyroiditis, what is autoimmunity, and homeopathy is one type of medicine which really helps in autoimmune diseases much better way. So if you have any questions, do write down in the comment section, and do share this video with more and more people. If you're new to my channel, do not forget to like my channel and subscribe to my channel, and stay tuned for my upcoming videos. Thank you.